This presentation is about Gulfport, Florida. It's being presented by Brian Gertz, Marina Carroll, and Amy Mahaney.
Today I'm going to be talking about Gulfport, Florida. Gulfport, a city located within Pinellas County, Florida, has had a few different names from the time of settlement and evolution. Throughout its history, this town has also been called Distant City, Bonifacio, and Veteran City. It wasn't until 1910 that the city's name was officially changed to Gulfport. This area is known by the locals as Old Florida, in a small, quaint waterfront area of St. Petersburg. Beginning in the 1920s, Gulfport began to prosper in many ways. Roadways were beginning to be built by brick, the population rose to 1,000 residents in the area, as well as a local hotel was built to accommodate tourism. The Great Depression slowed expansion in this area for some time. However, once the Depression came to an end, vast improvements in the quality of life and living conditions began. The town began water service and drainage systems to those dwelling in these areas. The community is a small waterfront community still at this time. It has evolved tremendously. It has a downtown area with a casino, beach with volleyball nets, dog park, historical museum, tons of local shops and restaurants. This town is full of local business and a close-knit community for events on a regular basis. The community of Gulfport, Florida is a very mixed community with a small town feel, from extremely wealthy to a minority population with a very low family income. This community is very diverse in population and educational backgrounds as well. The closer you get to the center of Gulfport and the downtown district, the structure is mostly brick roads and smaller cottage-style homes. In addition, if you extend outward, you will find housing areas with mansions and gated areas, and with just a small short drive down the side streets in the area, you will find well-kept cottage, suburban-style homes, and even on the same street, just houses away, homes that look as though they should be demolished and are boarded up. Gulfport is a small community with only a few churches directly in the area. With 12,371 residents, only 35.9% of this population is religious. The primary three contenders for religion in this area are Catholic, Baptist, and another Christian faith. With the vast diversity and large gay population in this area, societal norms are not typical findings in this area. Gulfport is known for its largely artisan population, vast styles of cuisine, and a very laid-back beach lifestyle. This area offers a fresh market on the streets known as the Tuesday Market, free trolley rides around the areas and to surrounding beaches, a small performing arts center known as the Catherine Hickman Theater. With transportation, there are buses that come around every 20 minutes on weekdays and every hour on the weekends. Public transportation is easy access in this community. A few areas of concern within the community. There are higher rental rates than homeowners dwelling in the residences locally. This in turn causes a turnover of not so pleasant and well-kept areas in Gulfport due to the lack of ownership and values in one's own property. With a high rate of bars in this community, the precedence of intoxicated people on a regular basis is a negative factor for the population dwelling in this area. Small community with less shopping areas. People will have to commute to get a wider variety of grocery goods or bigger commercial stores. Also in the Gulfport area, there's a lack of health care with urgent care centers, hospitals, or any other primary care offices. I do believe across the board the community does meet the needs of the area. However, there are certain things that could definitely be built upon from this time on.
Gulfport is on the top of the list with amount of homosexual same-sex unmarried couple households. According to CDC, incidence of sexually transmitted diseases is significantly higher among homosexual compared to heterosexual population. From public health and social order standpoint, homosexual activity may be viewed as dangerous and incompatible with healthy living. Moreover, homosexual population is more likely to experience stigma, prejudice, and discrimination, which has been associated with psychiatric disorders and substance abuse. Low birth rate is another issue in Gulfport. Birth rate is at its lowest in the United States overall, but in Gulfport, birth rate is twice lower than in its county and in the country. According to CNN Business, low birth rate has negative impact on the economy and the culture of the population. Extremely low birth rate may lead to fewer caregivers for elderly population. There will be less people to fill healthcare jobs and home assistants. Unemployment is 4.7% in Gulfport. It is almost double compared to the county and the state. According to our textbook, unemployment is one of the social determinants of health, and it leads to illness and premature death. Socioeconomic status has direct effect on life expectancy, birth rate, and many other health measures. Chlamydia, gonorrhea, and infectious syphilis are leading communicable infections in STDs in Gulfport. Cancer and heart disease are leading causes of death. Together, cancer and heart disease are responsible for almost half of all deaths in Gulfport. Gulfport has several pharmacies and stores that offer health-related items. All pharmacies are wheelchair accessible and provide plenty of parking, including for disabled population. All pharmacies accept different insurance plans. Hamsa Pasadena Hospital and St. Pete General Hospital are closest hospitals available to Gulfport population. Both hospitals accept major insurance plans and offer emergency care. St. Pete General Hospital has labor and delivery and women's care services. St. Anthony's Hospital is available in downtown St. Pete. It offers services such as surgery, oncology, neurology, and 50-bed inpatient psych unit. They take all forms of insurance and offer financial assistance for patients who are uninsured based on financial status. There are several nursing homes and assisted living facilities in Gulfport, such as Boca Ciega Nursing Home, Gulfport Rehabilitation Center, and Fountains at Boca Ciega Bay. There are no walk-in clinics in Gulfport. However, there are many walk-in clinics just a few miles away from Gulfport. For example, Bayfront Convenient Clinic in South Pasadena, Professional and Baycare Urgent Care in Tyrone area are available for walk-ins 7 days a week. All these clinics accept medical insurance and offer private pay options. Following Healthy People 2020 objectives were chosen for City of Gulfport. Initiative SA14 targets the problem of excess alcohol consumption among population. Gulfport is famous for a wide variety of bars and restaurants. Sunshine State weather, beach, and variety of alcohol serving establishments rise amount of alcohol consumption in the Gulfport area. This objective can help leaders of the community to work toward promotion of education to reduce alcohol consumption in the area. Initiative TU1 reduces tobacco use by adults. According to city data, Gulfport is third on the list of counties with highest number of residents that smoke. Smoking can lead to multiple health issues and increase medical expenses. This program may help leaders of the community to organize educational programs on smoking cessation and smoking prevention for younger population. The program should reveal various resources available to the residents to get necessary counseling and medication to stop smoking. Initiative LGBT1 was chosen to improve population-based data systems used to monitor healthy people objectives that include standardized approach that identifies lesbian, gay, bisexual, and transgender population. Gulfport being famous for number of homosexual households requires a standardized approach that recognizes uniqueness of this community and allows to achieve health equity, eliminate disparities, and improve the health of all groups. Community leaders should make sure that gender and sexual orientation questions are included in all surveys. Gulfport provides plenty of recreational resources to promote healthy lifestyle for all age groups. There are many parks in Gulfport where parents can take their children to play and get necessary exercise. All parks have many oak trees that provide plenty of shade on hot Florida days. Gulfport Recreation Center offers different recreation and social activities, classes, gym, and game space. It is a fun place where all age groups can find their favorite doings. Gulfport has a beautiful waterfront area. It provides plenty of beautiful views of Boca Ciega Bay. People can take walks, meditate by the beach, or play volleyball on the beach. It provides numerous opportunities for recreational activities and relaxation. Gulfport Police and Gulfport Fire Department both provide adequate service to its residents. Gulfport Police Department is a full-service law enforcement agency. It serves the city with a very quick 5-minute response time. Gulfport Police Department is responsible for safety of Gulfport residents, visitors, and Gulfport businesses. It offers to its community many educational programs. Gulfport Fire Rescue has community programs that includes fire inspections, public education about fire safety, hurricane readiness, swimming pool safety, CPR education, free smoke detectors, and installation. Residents can improve the environment through using recycled wastewater for lawn and garden watering. Recycled waste service is easily accessible and available for Gulfport residents. Areas of concern for Gulfport include insufficient parking. Gulfport has become a very popular area for a lot of visitors. Gulfport often hosts festivals, art walks, volleyball competitions, and other events. Often during event time, parking in Gulfport is very limited. Tightly parked on the side of the narrow streets, cars can lead to accidents. Another area of concern is limited bike lanes. Many locals use bikes as their transportation, but designated safe areas for bikes are very limited in Gulfport. It is a potential threat to bicyclists. Sidewalks are only available on Shore Boulevard and other larger streets. There are no sidewalks available on many streets in Gulfport. Walking in between the streets without a sign for pedestrians area is unsafe and a potential threat to the community.
So, analysis of the government and public policy. The mayor serves a 3-year term, and there are 4 council people who serve 2-year terms. I've got their pictures up on the side. You can see the mayor is Samuel Henderson, and the different wards are identified below. The manager, there's a city manager that is hired by the council that um, reports directly to the mayor and the council. So this is considered a manager council government. Um, they are very easy to access. They're available at council meetings on the first and third Tuesday of each month. Residents are allowed to come, listen to the goings on um, of the government. They're also allowed to speak on any topic that they wish to for 3-minute terms, which can be extended longer. So I've watched a couple of meetings, and at least 10 residents spoke at the meeting, and it was pretty well attended. So I wanted to address whether or not the governmental budget actually covered everything that the community needs. And they are providing for the public safety, as you can see on this chart, a little bit over 5.5 million. Water and sewer is another large one. They do provide for both recreation and community development. $3.5 million is spent on recreation almost, and about 1.5 million community development. They are working to improve seawalls. They spend a lot of money in the marina, which is highly used in the community for boating and a lot of the beaches and stuff like that are all included in the marina's budget. And you can see that they actually have no or very little debt on hand. The city of Gulfport actually has annually roughly a $2.5 million budget. It's built right into their governmental structure. So financially speaking, the city of Gulfport is in very good shape. Some governmental area items of concern. Some of these were addressed during the meeting that I went to. Parking in the downtown area near the beaches is historically bad. They're working on solutions. The government's working on solutions to try to increase the level of parking. Part of the problem is mixing the needs between the visitors to Gulfport, and there's a lot of residential areas right in the downtown area, and if they don't put signs up to protect those homeowners, people that are going to the beach will literally park right in front of their house. So it's kind of a mixed problem between the residents and the visitors, which the city needs because it relies heavily on tourism. Also, there's speed issues on certain roads. There was an accident that happened. I actually have a picture of it here that the person was doing 60 miles an hour and lost control. This is a dead end, as you can see, and they actually went all the way through this parking lot and off the seawall and ended up 50 feet into Boca Ciega Bay. Which is the funny thing is that in the last 10 months, that's happened twice in this exact spot, and in the last 5 years, it's happened 5 times. So certainly, in terms of public health, this is a safety issue. You can see that the uh, garbage cans are right there. According to the homeowner that spoke at the meeting, this is also an area where they walk their dogs and things like that. So certainly, safety is a key. And again, just wanted to touch on the budget is constantly a positive, so that's one less thing for them to worry about. So finally, I wanted to talk about the 6 areas of concern for Gulfport. After looking at the analysis of Gulfport overall and kind of discuss why I came up with these 6 areas. So overconsumption of alcohol. Gulfport has a lot of bars. Um, it encourages between the bars and the beach and boating and everything else like that. There is a lot of drinking that goes on in the city. I put this as my top concern because this has health benefits or health risks, for instance, in the sense of liver disease, increased risk of hepatitis, but also because of the potential increase of motor vehicle accidents with drinking and driving are all at higher risk. Secondly, there are a lot of smokers in Gulfport, as evidenced by the fact that cancer is one of the top causes of death. Actually, I believe it was the very top cause of death in Gulfport, going against national trends with heart disease ranking second. Both of these are affected by smoking, and so reduction of smoking in the city would help. There's a couple of just health related items here. So, like lack of sidewalks. There's no place for pedestrians to walk. There is in the downtown area, but as soon as you get into any of the residential areas, there's very few sidewalks in the city of Gulfport. Some of the major streets do have sidewalks, but for the most part, sidewalks. It's an older community, and they weren't thought of when the community was built. There is also a lack of bike lanes. Traffic on major roads can be an issue. Bicycling is a very good exercise, helps to reduce carbon, helps to increase exercise from the pedestrians. It's an easy way to get downtown and get around the community, and having no bike lanes doesn't provide any protection for bike riders that are having to share the road with cars. Low birth rates. It's an older community, and younger people are not living in Gulfport. This is just not sustainable in the long term. So this is one of my lower important things, but it was something that I thought was at least worrisome enough. And just in the health of Gulfport as a city, it's important to be attracting all age ranges of people to your city. So definitely looking at ways to make the city a little bit younger, is not just in the people who visit it, but in the residents themselves. And it is a transient population. There's an awful lot of rentals. That higher rental rate, just goes to show how people move in and out and in and out. When you have a higher level of people that are moving in and out, they don't care as much about their property, and it tends to increase crime and decrease home values, which, in the terms of health, can increase stress. Chronic stress can cause a lot of very variable problems. So the overall, I would say that the top six reasons here are in order because of how I felt that they would be most directly related to somebody dying, or being, a cause of mortality or in the community. And that's about it. Thank you.